Good evening. Good evening. If I can have your attention, please. We're about to serve dinner. If you would just come and get in line, it's open on buffet on both sides of the room. Thank you.
Yeah, we're yeah.
Do you want me to bring these up to you, or you're good right here?
Maybe behind this thing. Okay, perfect.
I'll have another copy.
Thank you. Yeah, that's good.
Well, I hope everybody's enjoying their wonderful dinner, and thanks to the chef there. We really enjoyed. Thank you. And the toffee cake that you recommended was really something to die for. That was awesome. I want to welcome everybody. We are all gathered here to celebrate two of our wonderful residents who have completed their journey and training and going on to practice. Dr. Jonathan Demeter and Dr. Ashwin Raghavan, their families, their parents, their siblings. Welcome. It's wonderful having you here. Faculty, residents, and thank you, Paula and Marcus, for putting this event together. Beautiful, beautiful arrangements. Thank you. And we are lucky to have two of our alumnus from the program to join us. Dr. Bob Concepcion and his wife, Jackie, if you don't mind, standing up or waving so that everybody can see you. And Dr. Shokar. As we get some new additions to the family, our new residents are here, and they'll be introduced. On a somber note, we lost a very wonderful person, a kind person, our ex-chair, Dr. Stephen Stone. Recently he passed away after a long battle with illness. He's at a comfortable, peaceful place now. I don't want to break the rule, but if it's okay with everybody, can we have a moment of silence for his peaceful soul? Thank you. And I'm going to invite Dr. Kropp. Everybody in the room knows Dr. Kropp. If not, he needs no introduction, but Dr. Ken Kropp is the one who started this program. He was the first chair and longest serving chair in this program. And urology in Northwest Ohio was established by him. He made his expertise known worldwide in pediatric urology. He was known for his kindness, for his love for teaching, and he was polite but firm. We remember training with him, always had a smile. You will go to him for advice, he'll listen to you with patient ear, and in the end, he'll say, what do you think? And put your thinking cap on. And then you will then think about a couple of solutions, and then you will come back really reassured, and then realize that he got the answer out of you, you had it in you, and he just unmasked it. And Dr. Kropp, you have been just wonderful. Please come and say some words, and if you can share your memories about Dr. Stone, that'd be awesome.
Well, welcome everyone. I look at Puneet. Am I supposed to say something that's written?
I took that program by mistake.
Thank you very much. But I do have to say something about your chairman, Dr. Simwani, because I was in clinic one day and he came in the clinic, the 1st of July, I think, and said, I would like to work in urology. I said, well, where are you from? He says, well, I matched in the Department of Internal Medicine, but it's a little bit boring over there, so we'd like to see some action. So I said, well, why don't you go see this patient in the room? And about half an hour later, he came out and he gave the most unbelievably detailed history of this patient. I was just blown out of the water because I'd never heard anything like that. Anyway, I said, why don't you come and get out of internal medicine and come to urology, which he did. They used to call, there were three of us that kind of were the originators of the Department of Urology. It was KK, JJ, and SS. Ken Kraut, Jagadish Jhunjhunwala, and Steve Selman. So that's how we were always referred to, as the JJ, KK, and SS. And I was, maybe a year into the chairmanship, and Dr. Selman came to my office and said, I would like to join the Department of Urology. And I said, well, what are you doing right now? He said, well, I'm in practice with the Oakleys, but I really want academic urology. And I had just lost a faculty member that had come from Hopkins, and I knew he only wanted to really go into practice. So I was concerned and questioning about, did he really want to be an academic urologist? So we had him in, and as I say, from the time I met your chief, Puneet, he was a wonderful, wonderful resident and the smartest. He knew everything. Now, Dr. Selman, I hope I don't get teary, because he was just a wonderful, wonderful partner. He again came and said, I do want to be an academic urologist. I'm in practice in the city. And I was a little bit suspicious that what did he really want to do? Well, it took about a half a day, and I realized his dedication to science and research in urology. So 20, 30 years, we were JJ, KK, and SS, and one of the best 30 years of my life, basically. I had a great, great deal of love for each and every resident. I just felt so strongly about them and how they would mature and get, the things that were needed, in my opinion, to be a really great urologist and doctor. Dr. Selman felt the same way. And so we were both on the same page, and it was a wonderful relationship that we had. I wish JJ was here. I hear he's had a little bit of a problem, but he was a very, very faculty member that was really great. So Dr. Selman, when he came, he said, I really want to be in the lab quite a bit. Okay, that was a little bit unusual. And he started the lab in the department, and pretty soon he's being invited all over the world for his expertise in photodynamic therapy, and made a great name, and was a wonderful, for us, who we were not even on the map, I don't think, in urology in Toledo, but he put us on the map. I understand, and I didn't see him in the last 2 or 3 months, but I understand he had a rough last couple of months of his life. And I don't know where he's going to go, but I hope I join him and he becomes a partner of mine again. Well, thanks so much, and welcome for the residents and their accomplishments. Okay, that's it.
Dr. Salman's favorite phrase in the OR was gentle like a bride. Anything you're doing, Puneet, gentle like a bride. Hold the tissues gently, suture gently. And that just, in one sentence, it was his personality. He was gentle, he was very kind. So we were thankful that we were trained by such stalwarts as JJ, KK, and SS. Next, I want to invite Dr. Ashok Kar, Dr. Concepcion and Dr. Shokar, they trained here in batch of 1985, correct? 85. So, Dr. Carr, glad to have you back here. I want to tell you one thing about Dr. Carr. I think 2019, Dr. Carr came, we met, and he wanted to do something for his home program. He trained here, he went to practice in California, he came back, and he gave a grant for the patients who cannot afford treatment and start a minimally invasive program in Haifu. And just today, every time a patient got a grant and got treated, they sent cards, heartfelt cards. So Cheryl, she's our billing encoder in the department. She told me yesterday, patient actually cried on the phone. He was so thankful for your donation to the program that they wrote a card. I hope you got it. I didn't open that, so it was sealed for your name. And they sent us a card saying that it was a kind gesture. Please forward it to Dr. Carr. Because of his kindness, they were able to afford the treatment. So Dr. Carr, thank you for that gesture. And if you would come here and share some of your memories, we'd appreciate it.
This is a little bit of a surprise, so I'm going to wing it. So, yeah, it was a wonderful stay in Toledo. We came here with nothing and made a life. And then a few years ago, we felt we got to give back. And so, this foundation donation was just to help patients who could not afford treatment for a new treatment that a lot of us surgeons did not believe in. And I have to say, Dr. Puneet Sinwani has taken this to the next level. He's now teaching HIFU courses at the AUA, which was, a big kudos to this to Medical College of Toledo. I'm sorry, I know it's UT, but I still call it MCO. Anyway, when I came here in 1979, I started with the general surgery program. And then through our rotations, I rotated with Dr. Kropp and Dr. Junjunwala. And that time, Dr. Selman was not there. And I loved urology. And Dr. Kropp, hopefully he liked me, and he offered me a position in urology. So I'd started, mid-year, I'd started in January. So I went to Dr. Thamford, who was the chairman of general surgery, and said, thank you very much. I've enjoyed my stay in general surgery, but I'm going to be joining urology as of January 1. And he said, over my dead body. You are committed to me till 30th of June. So I was between the devil and the hard place. And so I went back to Dr. Kropp and I said, what should I do? But through the kindness of his heart, he kept the slot open for me, and here I am, having trained as a urologist. So Dr. Kropp, JJ, and Selman were the finest, human beings that taught us, all so kind in their own way, and yet they were firm and got the message across. Especially Dr. Kropp, as Dr. Sinwani said, he always had you think up the answer. Even if you had a question, he'd have you think of the answer. And even though I went out to California and I was a faculty at UC Irvine with Dr. Clayman and Dr. Martin, when I was in trouble, who did I call? Dr. Kropp. So for many, many years after that, I've never forgot that. And Dr. Concepcion and me were co-residents. He was the good surgeon. I didn't have the skills that he had, but I tried as much as I could to keep up with Dr. Concepcion. But it was fun. We were always together, helped each other. And my message to you, the young residents, do not make money the object of doing medicine. If you make money as your object in life, you will be disappointed. What you get here with somebody telling you that you saved my life from the surgery that you did for me, no amount of money is going to give you that. And so good luck to the residents that are passing on. Stay humble, and don't let pride get the better of you. So that's all I have to say. Thank you.
Dr. Concepcion is shaking his head. I want to acknowledge we had a wonderful lecture this morning, about how residence training should be chartered. And please give, again, a big hand of applause to Dr. Rama Jayanti. Amazing. He was an invited speaker for CROP Symposium this morning. The things he said, one of these things, follow your passion, and how he, at his late in his age, he picked up a second passion. He loved flying, and how it translates into resident training. It was a great lecture. I really enjoyed it. Now I'm going to hand it over to my faculty, Dr. Al-Zawari, our program director. He's going to do some department introductions, followed by Dr. Ekwena, who's giving the resident award, and of course then the big event after that.
Thank you. Thank you everybody for coming today to celebrate with us our new stars in the urology world, Dr. Ashman and Dr. Jonathan. I would like to congratulate you about your graduation. It's a long trip, hard work, and now we are going to start collecting the rewards. The rewards is serving patients. So you have to remember always the mission is to serve patients. And not only that, the mission of physicians all the time is to teach, take care of people around you. Altruism is most important. So whenever you are in your place, remember to teach other residents, other students. When they go out, they are going to be representative of you. So basically, you are representative of us in anywhere you go. So please be a good representation for us. The second thing I would like to add, remember from the lecture in the morning, it's very important lessons that you always learn, think about learning, and be humble. This is very important. And not only that, you need to be affable and available so people can always rely on you. So it is always important, remember that, patients, community around you, people around you. Let's give applause for them and congratulate them. And I'm going to have Dr. Ekwena come. He's one of our associate professors, and he is a wonderful guy. He is lead of the transplant team in our department. So please come on and start to introduce our resident awards, which we have every year for some of our residents. So I'm going to leave you the stage.
Ahmed, you want to introduce our incoming residents, if you don't mind?
Yes, Stephen and Abed. These are our new stars. They're going to start the trip. And hopefully learn some from them before they leave. Thank you.
Well, every year we try to sort of recognize some of our residents in research and for their academic work. It's a very difficult journey to get to this point. There's a lot of clinical duties for our residents. And in addition to all that work that they have to do in terms of trying to learn, there are other responsibilities that they have. And so we use today to sort of recognize some of these extra things that the residents have to do. And so, not that the rest of the residents are not doing their part, but as I said, this is just to sort of recognize these very special residents. So the first award that we give is to recognize the Best Academic Performance Award. And this award is given to the resident that exemplifies most of the time. And I qualify that because they all, do their best, as I said. But the resident exemplifies the best conference presentation. So the residents are required to present on different topics. They actually teach us, the faculty, a lot of times, and themselves. So we pay attention to these presentations. Abbott and Stephen. So we do pay attention, okay? So the best conference presentation, academic achievement, there's a test The tests don't stop. So there is a test that every year, the in-service exam that residents have to take. So we look at those scores. Learner evaluation. So residents are teachers. Residents are teachers. They teach the junior residents. So the senior residents teach juniors. The juniors, they teach the medical students. And evaluations we look at those evaluations, and believe it or not, they tell us something about how the residents are doing as teachers. In addition, following up on reading assignments. So we're constantly learning, and those that follow up, we pay attention to this. And also preparation for conferences. So this award for Best Academic Performance goes to none other than Jonathan Demeter, the graduated. So not only is he graduated, and he's still one of our best. So congratulations.
Thank you. I appreciate it.
Absolutely, sir. This is a little token.
Thank you.
You know.
I'll give my words later.
Yes. Excellent. Well, very well. All right. The next award is for research. As physicians, we're still, very much we're involved in inquiry and looking at how to get things better for our patients. And so research is a big component of what we do as academic urologists. And our residents are a big part of that. And so all of our residents are required to publish and to present at various academic meetings. And so they're all involved, as I said. And so this award recognizes the resident that mostly does this exceptionally. And so we look at inception and design of a research study. So the resident has been involved in starting a project and getting it going. Timeliness and following up with the project and presenting the research project, and also publication, because obviously, a research project that nobody knows about is just for your head, I guess. So we want to recognize our residents. Again, it's difficult, to carry a lot of the clinical burden of learning urology and be excellent at urology research. And so we want to recognize this resident, and it's none other than Sonia Massey.
Yeah.
Dr. Massey, up here, and this is a little token to recognize all the work you're doing. Absolutely. Well, very well. And the last award is for the Best Patient Care Award. Again, a lot of the work that's done, as Dr. Ezra already mentioned, is that we're here to care for patients ultimately, and this award is the Best Patient Care Award because our patients do report to us on how our residents are doing, and our residents do an excellent job taking care of our patients. But we just want to recognize this resident for their compassion, and this is based on physician feedback, patient feedback, family feedback, staff feedback, and how they interact with the hospital staff, process improvement and communication. And this award goes to Dr. Gita. Gita is not here today, but we do want to recognize her, and we'll get the award to her. So please give a round of applause for Gita. Fantastic. I think the next item is Dr. Petros. He's going to come up and take on the next agenda item. Thank you.
Again, thank you everyone for being here, and thank you for the invited faculty member being here. And congratulations, Dr. Raghavan and Dr. Demeter. This is your big day after 5 years of residency, medical school. This is what you were looking for. You should be proud of yourself and your family as well. So I'm going to give you a simple gift for your office and a picture of the University of Toledo to hang in your office, whether at home or at work. So Dr. Raghavan. Dr. Demeter.
All right, the fun starts now. The serious stuff is over. So residents, the podium is yours. I think, oh, sorry. Did I miss something? Oh. Thank you, Paula. We won't be able to do anything without you. Dr. Kropp, this is Ohio State's Foundation Award for the lifetime achievement that was awarded to you in Columbus, but you couldn't make it. You did a virtual appearance. We were supposed to give it to you in person. So Dr. Kropp, Lifetime Achievement Award. Diplomas right now? Okay, wonderful. Now, the diplomas given for graduates. University of Toledo certifies that Ashwin Manakal Raghavan has successfully completed a residency in urology. July 1, 2017 through June 30th, 2022. On this big day, please come and get your certificate. The University of Toledo certifies that Jonathan Demeter, MD, has successfully completed a residency in urology, July 1st, 2017 through June 30th, 2022. Dr. Jonathan Demeter. Thank you. All right, Jonathan, is stage yours or the junior starting, or what's your plan? The roast starts.
Yeah, I'll follow that. The last word.
All right.
I find it funny they put stakes up there to exemplify the roast.
Birthday gifts for There we go. All right, wonderful.
All right.
Can everyone hear me? All right. So my name is Kwabna. This is Jennifer. We're the PGY Threes. We're going to do the roast of Jonathan and Ashwin. We spent, 3 years now with Jonathan and Ashwin. I personally spent 9 months with Ashwin this year, probably more than his wife, so spent a lot of time with the man, and it's a lot of weird habits of Ashwin that I think everybody's going to enjoy getting to know. Take a good look around. You know, this might be the last time the program is graduating 2 white men, so let's give a round of applause. All right, so this is just, there we go here. Okay, perfect. So congratulations to you guys, Jonathan and Ashwin. We're so proud of you. It's the whole cohort here.
That works.
All right, it's baby Ashwin. I'm sure even at a young age, baby Ashwin was telling everybody how handsome he was. So, and this is baby Jonathan.
Actually, is that baby Gounder? I don't know, is that baby Bennett? That's
So
baby Bennett.
I had to do a double take because I wasn't sure if that was Jonathan or that was Bennett. It's eerie, man. What's going on here? Ashley doing all his work and Jonathan, you know, Bennett just comes out looking like him. I was telling the other residents that to know Jonathan, to know that he's a very principled person, and I said, I'm surprised that Bennett has been living in the house for 2 years and has not paid taxes. So, I'm sure in the coming year, you know, he's gonna have that man paying taxes and paying his dues. So this thing is got a mind of his own. All right. So residency has been a good journey for both of them. Jonathan has created a beautiful family. Bennett and baby, what's her name? Kaylee. Wonderful family there. Ashwin, this thing is, okay. Ashwin is also a wonderful family, wonderful support. You know, they always say that it takes a village, you know, to see the whole family here supporting them. I just want us to sort of give a round of applause because I know that when I graduated med school, I wouldn't have done it without my family. So your family's here, give them a round of applause for yourselves. And now the fun begins. All right, so, oh my God. All right, so anybody that knows Ashwin knows that he's a very humble person. It's like, you know that it doesn't take you 5 minutes for him to tell you, you know, how good he is. And so it's funny because with the first time I met him, I said he reminds me a lot of DJ Khaled, right? Within 5 minutes, I the best. Bob, you're not gonna believe what happened today, man. I was in the OR with Dr. Big. He just let me do the whole case. Okay, oh yeah, that's cool. I talked to Dr. Big. You know, you did a little bit. Ashwin's like, and you know, you're crazy. I did the case with Dr. Sinwani. He let me do the whole thing. I actually taught Dr. Sinwani how to do the variable selective. Really? Really? Okay, so, you know, that's sort of one of my fond memories of Ashwin, sort of always getting a good lesson and, you know, okay, you know, all right. So I'll take that from him. Jonathan, to know Jonathan, like I said, he reminded me a lot of Ned Flanders. If you've ever watched The Simpsons, Jonathan, you know, it's funny, every time I tell Jonathan, yeah, Jonathan, man, residency's tough, I'm struggling. Pain is fine, man, Kwabna, you'll be okay. You'll be okay. Pain is good. You gotta suffer through it, Kwabna. I'm like, damn, Jonathan, you know, let me just, no complaining here. Put on your big boy pants. So every time that, you know, he sort of gave us those lessons, gave us those, you gotta be on time at 4:30 to see patients at 6. It just reminded me of Ned Flanders. And he got the same kind of glasses too, so. You know, all right.
This thing is not working out.
This thing. There we go.
Oh, well, here's
All right.
Jonathan. Here's Jonathan rounding at 4:30. He always says, if you're 10 minutes, oh, there's back. I went back. Well, oops, I gave him the pass. Well, here's Jonathan at 4:30. Normally he says, if you're 10 minutes late, you're going to be late to pre-op, you're going to be late to see the patients, you're going to be late to write notes. He always instills in us that we have to round super, super early, even getting all the supplies, as you can see Jonathan here with his urinal in the back pocket, after doing
We
a
don't
wardrobe.
know if that's for him or that's for the patient. He did always tell us about efficiency, so I kind of wonder sometimes.
In the OR. However, Ashwin, on the other hand, well, this worked. This is a compilation from July 2021 to March 2022. These are all on different dates. We all know what Ashwin does best.
So, believe it or not, we couldn't actually fit all the pictures there.
Yeah, we got a lot more.
You see in the left corner there, I mean, they say sleep like a baby. That's got to be it, right? But, you know, he did enjoy his sleep. Ashwin would always tell us, you know, Kwame, I'm coming in. You know, you guys got to come in 5:45. I will be there. I will be there, okay? 5:45. Where's Ashwin? Nothing. Start without him. Okay, we round without him. 7 o'clock.
8
Where's
o'clock.
Ashwin? Noon, my man strolls in. All right, guys. So, is the patient pre-op? Did you talk to Dr. Quina? Did you talk to Dr. Sandwani? And you know, so that I think is one of the things that sort of sticks with all of us, is that he had a fondness for coming in and letting us know who was boss, even when he wasn't present.
So basically, this is a typical work day. As you can see, John rounds at 4:30. Ashwin rolls around 8, 9. And then one eternity later, basically later on in the afternoon, if this works. Whoop.
So what that's a video that's, the
You have to
fire
hit
alarm was
play.
going off. Are you able to play that? No?
Oh, come.
It's okay. I think it's better if we describe it. So basically, the fire alarm is going off. It's been going off for about 15 minutes. Ashwin is still comfortably sleeping. The place is burning down.
It's an actual video. It actually shows the alarm going off, and Ashwin just puts his, readjusts his headphone and goes back to sleep, turns the other way. However, John, on the other hand, 9:30 p.m., still rounding.
This has been an all-day event. You know, it's like when you're kids and are we there yet? Are we done yet, Jonathan? No. We got to ask the patient, what did they eat for breakfast? How many size portions? How many grains of rice? And I think that just speaks to how thorough Jonathan was. You know, it would always just be, so we would round 4:30 to 9:30 p.m. every single day.
So then you ask yourself, okay, what have all these seniors been doing all of the day? So this goes. So what has Ashwin been doing all day? We basically ask ourselves. Oh, what, back there? Okay. Well, as you can see, Ashwin loves watching his urology videos. That's Ashwin watching some Grey's Anatomy.
Grey's Anatomy with his bang on the side. It's Weeders is open to page 1.
He loves being on Reddit. Where am I pointing? Where do I point? This way? This is Ashwin. I don't know if you can see, but if you take a closer look, it's actually looking up an interesting topic. I don't know why he was looking about that on Reddit, honestly.
You know, he always used to tell us, you got to read, Kwame, you got to read, Jen, you got to read, you got to read. Maybe this is what he was talking about.
Honestly. And then he loves taking 10 naps per day. As you can see here, he's getting ready for his other nap. As you can see, that is his favorite blanket. Has all his bodily fluids on it.
So this picture, Ashwin did love being a urologist, and he did love telling us that his favorite procedure was IPP. So we're not sure what's going on here. All we know that he did enjoy sleeping on that couch. He did enjoy good IPP, so I will let your imagination do the rest.
And here's Ashwin after...
Comfortably relaxing.
So you ask, all right, what has Jonathan been doing? Jonathan's been busy operating. Jonathan gets excited about his Pop-Tarts. And then Jonathan's most favorite thing of all.
So this is our good friend Karen here. One of the things I learned from Jonathan was Quadman, you gotta report her. You gotta report the nurse. I mean, she did that? Yeah, you gotta report that. So we spent a lot of time at UTMC reporting people for not putting catheters in, calling things in. And in this next slide here, this is one day that we spent with Jonathan. So you can see the first safe care was the nurse did not remove the Foley at 10 a.m. She removed at 11 a.m. Okay, fair enough. At 11 a.m., the next thing was she did not bring the GU card. Okay. The scrub tech did not pull my correct glove sizes. Okay. Today I sneezed and the nurse did not say bless you. Okay, Jonathan. I mean, I will report it. Medicine resident ordered a CT. That's fine. Today I saw someone parallel park. They did not parallel park correctly. Very principled about that. And then today he ordered sloppy joes. The sloppy joes were not sloppy at all. Then of course he's got to circle back about the parallel parking. And then he safe care actually. He ended up, one of the days he was like, we need to safe care these guys because I don't think anything is getting done to me. People still not parallel parking. My sloppy joes are still not sloppy. So we actually ended up safe caring the safe care people.
And one of then you ask yourself, all right, so this is what they do on the weekends. So what do they, weekdays, so what do they do on the weekends? So we pulled some pictures from their family life, and as you can see, this works. Ashwin likes doing the same thing that he does at work. Sleeps on the couch with that blue blanket, but now he has cats with it. Ashwin, while his wife is running full marathons, Ashwin runs the last leg of the marathon and says, I ran the whole marathon. He's like DJ Khaled.
This is true. He was telling us, Quadman, I can't come in today. I got to prep for this marathon, man. I'm running this marathon, blah, blah, blah. Really? You're running a marathon? It's like, no, it's actually an ultra marathon. She's running 100 miles. I'm like, you running 100 miles? So, come to find out, he didn't even do a mile. I mean, my man didn't even do a mile. Come to find out from Ellie, but he did post on the resident group chart that I'm so exhausted today. I spent all day running. So, congratulations on completing your marathon, Ashley.
And here's Jonathan, who actually ran the full marathon, but didn't even say anything about it until one day we were talking about Ashwin, how he ran the last leg. And then he's like, oh yeah, I did a marathon, and I run like 20 miles per day. And we're like, what, Jonathan, what is this? But, that is, I guess that's Ashwin and John. Like, and here is Ashwin. I don't know what he's doing, but he kind of looks zoned out, trying to focus on the laser. I wonder if this is how he looks in the operating room. If I can do this.
Ashwin loves video games. Jonathan loves a good pair of socks.
The same socks he's wearing today, actually.
So I don't know. I mean, as a man who's very principled, I would not be surprised if Jonathan only has 2 pairs of socks. Washes them every day, hangs them on the dryer, gets them at 3:30, comes to rounds at 4:15.
And here's Ashwin enjoying his creatine. He's always talking about lifting and how he lifts and how he's so buff. But on the weekends, he actually likes to boast about himself a little bit. So he posts.
Ashwin likes to boast?
Oh!
So
he posts on Instagram about his workout, but there's one thing he missed: leg day. He never skipped leg day. So he's kind of like Johnny Bravo. And some memories that we're never going to forget. Thank you, Ashwin and John, for these past 3 years that we've been with you, but we've learned a lot. Some of our most memorable moments. Here's Jonathan freaking out about a text message that was sent 2 days ago. We already had taken care of it. It was a Saturday. We're just, I'm chilling on 2 hospital call. Jonathan's back up, and then he texts me, hey, Jen, did you call Dr. Murtaugh? Because he just sent me this text. I'm like, Jonathan, this was 2 days ago. And John's like, oh, all right. And he's like, is this a duplicate? And I'm like, yeah, man. He's like, oh, I'm so sorry. My phone is messed up. But this shows basically the dedication that John is so thorough that he even tries to do the same task twice. Here's Ashwin when he asks us to double scrub a case just to watch him operate.
And then tell us how wonderful he was. To be fair, he is wonderful.
Here's Ashwin, and this was my intern year. I wrote left stent ureteroscopy, left stent cystoscopy, and Ashwin just crossed it out and basically wrote cystoscopy, left ureteral stent. This is when Jonathan messaged the resident on call about his penis pain. This works. And congratulations to Ashwin. He's going to be the senior most partner of ProMedica. You guys?
Also the most handsome, as he told us.
The most handsome of all urologists in Northwest Ohio.
It's verbatim, right? What were
Exactly.
we talking about? He said, probably, like, I mean, have you ever thought about who the most handsome guy in the program is? I was like, well, I mean, I think Sheila, but okay. He's like, no, you don't think it's me? I'm like, okay, over Shiva? He's like, no, not even just residents, all attendants. I'm like, really? So, Dr. Sinwani, Ashwin officially is now the most handsome urologist.
And congratulations, John, for joining urology clinics of North Texas. Basically, this summer day is a spring day in Texas, so it's going to be 10 times hotter. So, can you play that song? No, I can't? No. Well, I think it doesn't play. It had a song in it, but I guess it didn't.
You want to sing the song for them?
No, I don't want to sing the song.
Well, congratulations, you guys. You know, I think these 3 years have been, you know, all jokes aside, these 3 years have been really phenomenal learning from you guys. I've learned a lot.
There you go. Wait. That's not it. That's not it. That's the wrong song. Hold up. Let me see. I was going to make this a little high school-y-ish. There you go. Something like this. Well, it's just basically the graduation song from Vitamin C, basically back in the 2000s. But congratulations, John and Ashwin. We'll have a lot to remember you by. Some things we will learn from, some others we'll laugh at. But congratulations, guys.
Thank you, guys.
I wasted so much time on that. All right.
Thank you, Jenna and Kwabna. That was very appropriate, I guess you could say. And you kept it, you know, tame enough. Okay. So this is a very special day for me, and just thinking back on the journey, I remember as a medical student, you know, talking with my family and my parents, and after I started my urology rotation, I said, you know, this is a field that I really can see myself in. I think this is my passion. I love the endoscopic, the big surgeries, you know, but I don't know if they can do it. And they said, well, if this is what you want to do, this is what you need to try. And I remember talking with Dr. Sinwani and being in his office and telling him, you know, Toledo, I think this is the place where I want to train because, you know, I'd seen the other residents, I'd seen the quality of education, and I'm just so thankful that you gave me the opportunity to complete my residency here. And I also definitely want to thank my family, my mom, Brenda, my father, Joe, all my siblings, Jacqueline, Jason, and Jenna, and to all the doctors that trained me, Dr. Jayanthi. I remember working with you even for a couple days in medical school. I don't know if you remember that, but all the UT faculty for sure, Dr. Kropp for teaching me pediatric urology and the principles of surgery, for all the ProMedica guys, Dr. Rashid, Dr. Fumo was here, I don't know where he went, but he was first my chief resident that I worked under, and he taught me a lot, how to be efficient. He really kind of gave me a, you know, proverbial swift kick when I needed one to really step my clinical care and efficiency up to the next level. I know Dr. Hazelhun's not here, but I want to thank him and all the guys at the Romeus group. I know Dr. Santa Croce was there this morning. So, and to my co-residents, you know, without you guys helping me out, I wouldn't be here today as well. So, and of course to Ashwin. And I definitely can't leave out my wife and my 2 new kids. So thank you for being there for me through all this and for our journey that we're going to have together in the next decades to come. Thank you, guys.
Sorry, there's one more gift we forgot to give Ashwin. Ashwin, congratulations for your graduation. Here's the blanket you always use. I was supposed to with the blanket.
I need to put it on like I was wearing it. There you go. It's very comfy. I recommend it. Thank you, Jen and Kwabna, for that very insightful look into our last year of residency for both John and I. I will humbly pass the Most Handsome Man Award down to my future chief resident, Dr. Shiva Damodaran. So this blanket will find its way to you in some way, shape, or form over the next year. So, on a more serious note, you know, I really appreciate all of you for coming here tonight to celebrate with John and I. It's been a really good 5 years. It's been a very difficult 5 years, and it was nice to hear, you know, John's inspiration into pursuing urology. For me, I grew up with a major urologic condition, and so you know, urology has kind of always been, for better or worse, near and dear to my heart. I was very thankful to get exceptional urologic care as a child and an adolescent, and so that ended up pushing me towards thinking about pursuing urology as a field, and that I could specialize in, because, you know, what would be cooler than becoming a physician that, you know, that specialty, you know, helped you so much when you were young. And so getting being able to see both sides of the coin, so being able to be a patient and then also coming and being a urologist, I think is an exceptional opportunity for me in the future, and hopefully will serve my patients well. I just want to take some time to just briefly thank everyone in my life for the last 5 years who's been a part of this journey. First, a lot of the, you know, support staff who've been part of these last 5 years have been really instrumental in their patience with me as a young resident, transitioning to now as a senior resident. So the nurses on 4AB at UTMC, the nurses on 3B at St. V's, a lot of the OR staff at all 3 hospitals that I've worked at, some of the surgical first assistants at St. V's, particularly Megan and Molly. I just want to thank all of you all for being part of my journey and helping me along to where I am now. I want to sincerely thank all of the attendings I've had the honor of working with over the last 4 to 5 years, who really helped me from progressing from a fledgling junior to a competent and capable chief resident, hopefully well-to-be evidence-based, you know, patient-centered attending in the future. Starting with UTMC, I'd like to first thank Dr. El-Zawari for his guidance in reconstructive surgery and surgical efficiency. Dr. Petros, who really taught me a lot about the management for patients with urologic oncologic issues, specifically a lot of complex patients. I really appreciate your mentorship. Dr. Aquena, for allowing me to develop my ability to form a good sense of clinical judgment, you know, letting me roam free in your clinics and come up with patient plans has been very instrumental in me in terms of learning how to talk to patients, how to approach them, how to form relationships with them. So I appreciate you for that, and also for allowing me a great deal of autonomy in the OR as I progressed from a junior to a senior resident. Dr. Reese, who unfortunately can't be here today, but I was very thankful that he took us out on his boat last weekend to celebrate us. And then Dr. Bennell, who's not here, but I learned a lot of my pediatric urology from. Both of them were very exceptional in my training for teaching me about surgical precision and the nuances of open surgery. I was also very fortunate enough to be with Dr. Kropp for his last major pediatric urology case with a Mitrofanov creation before he retired for good. And so I really appreciate your guidance over that time that I spent with you. And then lastly, but not leastly, Dr. Sinwani, over these last 5 years, you've really helped foster my ability to critically reason, critically think about patients, not only about what's right in front of me, but looking at the patient as a whole, looking at what all is going on with them, and in that way be able to synthesize ways in order to help take care of the whole patient and not just the urologic issue. So I really appreciate you for that. Next is the ProMedica GU surgeons, who fortunately enough will also be my future partners, so I'm very thankful for all of them. Specifically Dr. Boyle and Dr. Rashid, who's sitting here right now. They took me on as a know-nothing PGY2, and even as a PGY4, starting off as the senior on the service, still not really knowing how to run a service or operate at the level of complexity of a lot of the robotic and major urologic cases. They really mentored me, were patient with me, let me make mistakes, let me fix those mistakes, and so I truly appreciate you taking the time to do that. And it's really helped me become the person I am and hopefully the surgeon that I am. Dr. Fumo and Dr. Simmons, Dr. Fumo is here. They were both my chief residents, and so I've really been honored to be part of their transition as they become really well to be attendings and getting their practices in full swing. And so it's been really nice that they've seen me as like an equal almost now. And when I'm doing cases with them, we bounce ideas off each other. They let me know their thought processes. They're giving me tips on like what to do when I start my own practice. So it's been a very nice position to be in, having them not only as my chief residents, but also now my partners and mentors in that aspect. The Romeus group, Dr. Zafar has helped me a lot in terms of mastering urologic endourology, and really tailoring a practice to focusing on how to do the smaller cases well, how to do the bread and butter of urology really well. I really appreciate him for that. Dr. Baig, challenging me as a senior resident in improving my minimally invasive expertise and efficiency. And then a few special thanks I'd like to give to 3 of my attendings, and those are Dr. Schuster, Dr. Hazelhun, and Dr. Santa Croce for their mentorship over these last few years. Each of them has been instrumental in my growth as a clinician and a surgeon. Their patience with me, their clinical and personal guidance, and giving me a lot of autonomy in the operating room from the small to the large cases, and again, kind of allowing me to make mistakes that maybe other people would get nervous about, and letting me kind of reason through it, take the time to kind of troubleshoot, fix those mistakes, has been invaluable for my learning and education. And each of them has individually really invested in my growth as a person and a urologist to be. So I want to thank all of my attendings. Can we give them a round of applause for... I also want to thank my family. So my parents are in the back. They've always been my biggest fans. They've supported me not only through residency, through med school, through all of my life, through dealing with a lot of issues growing up. And so they've always been there for me to fall back on in times of need. And they've really loved me unconditionally, and I'm really grateful for that. They were the ones that really inspired me to pursue medicine in the first place. They're both practicing physicians. If you talk to them, you can immediately tell how passionate they are about their patients. how much they care. And so they've really been instrumental in fostering my passion for medicine and following that in urology. My brother is also here. I really appreciated the time I've got to spend with him watching him grow up. He's been able to check in with me during my training, and I really appreciate that. He himself is undergoing a busy surgical residency in otolaryngology, ENT, at the University of Washington in Seattle. So I'm sure I will be on the opposite side, checking in on him, making sure he's doing okay as he progresses. My wife's family is also here. My in-laws, my father and mother-in-law, my brother-in-law here. They've also been very supportive, very loving to me during this time and throughout the time that I've known them. And so they've really been a big part of getting me to where I am here today, and they're here in the back supporting me as well. And lastly, but certainly not least, my beautiful wife, Ellie, who without, I would never have made it this far, 100%. I owe my success as a man, a husband, and a future urologist to her devotion and guidance for the last 5 years and beyond, even in the hardest of times. And I just really want to say that this celebration is just as much for her as it is for me. So can we give her a round of applause? So I went a little longer than expected, but I appreciate you guys taking the time to listen to me, so I will leave it at that. Thank you.
Well, thank you for residents, juniors, faculty. It's not overstatement. It takes a village to raise a child, and same thing, it takes a whole complement of staff, attendings, and everybody involved in making a student into a resident, now a great attendings they're going to be. A big round of applause to Paula, who did that. Paula, could you please stand up? So Paula is our, please. Yeah. This is Paula's first event she put together, as our residency coordinator. Paula, you did a great job. Thank you so much. And Marcus, great job in getting our alumni here. And Marcus's plan is maybe next year we're going to have a 10-year cohort and get all the alumni day before and have everybody meet everybody. Dr. Carr and Dr. Concepcion hasn't seen each other since they graduated. So they were saying they're so thankful that they got a chance to do this in person, and that's what they want to do. So guys, when you go out, keep in touch with each other and keep in touch with the program. This will be your home base. Come and meet us, and that we'll be thrilled to have you at all different graduations, everything. So in closing remarks, thank you everyone for coming. I hope everybody had a good time and you enjoyed it. And please, some pictures are to be taken. That's the next item. With your family, with your friends, have a great time. Thank you. Somebody's gift here. Do you know what that is?